So we had the drought. Then you've also been really busy with the catch-up campaign and the immunization of children.
Yes. So the saddest part with that was with the strikes of the doctors earlier in the year and then later the nurses, I think the backbone of our health sector was really, really damaged because, you know, whether one likes it or not, nurses are a pillar in this health sector.
For sure.
They're the ones who do the immunization. So with the strikes in the government hospitals, and it's a devolved function health for over 5 months, all newly born babies for those 5 months were not being immunized. And they're not being vaccinated, which means, you know, over 500,000 children that were born, especially in these hard-to-reach areas where there are not hardly any private clinics and hospitals. They're very vulnerable, and they're always the ones to be first wave of shock hits them. So I think thanks to the Minister of Health, Dr. Mailu called me with the country director of UNICEF and said, look, can you help us as Red Cross? I said, with what? With immunization and so on. And they said, you guys have the ability to turn around things very quickly, so can you help us? So what we actually did was to select with the government, ministry headquarters, 11 hard-to-reach counties that were most impacted and affected by the strike. So we actually went back and rehired those nurses who were on strike.
Oh, interesting.
In 11 counties, in each county we had 30 nurses, so 330 that have been on our payroll for the last couple of months, doing a catch-up campaign to catch up with the lost vaccination of those newly born babies. I mean, we haven't seen the end of that problem, Gina. I mean, the sad part is that we could have kids getting back polio and getting measles.
That's absolutely terrifying.
And that's the saddest part, when this had been eradicated. So we are hoping against all hopes that with the catch-up campaign, which is ending actually next week, that we will have covered that gap, and hoping that nothing bad then happens to these children. But it just shows you how vulnerable we can be as a country and as a community, that we need to be, you know, we cannot allow you know, labor dispute to go for that long for such an essential service like healthcare.
No, absolutely, absolutely not. Then of course we had the elections, and you know the violence that came out of that, and of course the Red Cross was first on the scene as always.
Sure.
So you know you've had lots of things on your plate in 2017 for sure. What do you see the challenges of 2018? What do you think the challenges for 2018 will be? I mean, I think we're all looking at it as hoping it'll be a better year, because I think 2017, just from a business point of view, has been a really tough year for all businesses. So we're really looking that now that we're out of this political impasse, that 2018 will be a better year. But from a humanitarian point of view, where do you see 2018 going?
So looking back again at 2017, and especially the election, as you rightly say, it's not been an easy year for the business community. I mean, as you know, Red Cross runs business like a hotel business, and I can tell you this year was worse than even the other few years in the past in terms of your bottom line. We have not been able to meet our bottom line by far, and this has happened to many companies. In terms of Red Cross itself, I think in relation to the election, I think, as you rightly said, we were prepared and equal to the task. Thank God it didn't go to the worst case scenario. We had 3 scenarios where the elections will come and everything there'll be a contest, there'll be a winner and a loser, results accepted and we move on. And there was a second one where there was going to be an election, result contested, but maybe not total out violence, and some will go to court, is what actually happened in August 8th. But I think 26th August, second election, wasn't good from the perspective that it really divided the country. My biggest concern for 2018 as a nation is how can we hit the rift that has existed during this last election. There's a huge division, and I can see this from a service delivery. I mean, we've been out on the road before 8th of August and up to now, where there are people who lost their lives, many, maybe not the same numbers as when we had 008, 007, but certainly there are Kenyans who lost their lives. There are many that have been injured, that are still in hospitals, that we are still assisting as Red Cross. But as we go forward to 2018, yes, as you rightly say, everyone hopes that the economy will improve, things will change, and we move on. But my biggest concern is some of the challenges that were in 2017 have not been fully addressed. I hope the issue of the healthcare, nurses, doctors, the various trade unions, the issue of the economy itself, I think is a major thing to worry about. We hope and pray that it will start turning around and for the better, so that all these people who had been laid off can find some meaningful way of re-employment. We've also been addressing issues of youth radicalization,
Yes,
Gina,
yeah.
quite a bit on the Kenyan coast and here in Nairobi, through a platform of what we call youth dialogues, to understand what drives them to either join terrorist groups or join gangs in this country, whether here in Nairobi or on the coast or other places. But all of it is all quite similar. Unemployment, education, lack of opportunities, hopelessness is what is among these young people. Issues of corruption is another one that they talk about. So we hope and pray that now that the election is behind us and the president and his deputy have been sworn in, hopefully once the government is appointed, then we can see positive change or turnaround. But importantly for me is the healing, because of the levels of division. It's not very good for this country, for our country.
And what do you see healing as? And what, if you were to say healing, how would it look?
I think for me is where the top political leadership put their differences aside, personal differences aside, put the nation on the front, and have a meaningful discussion in terms of reforms, whether it's election reforms, whether it is reforms within the various government agencies that have been set up, whether it's the police itself, whether it's human rights, whether it is IPOA, all these bodies, judiciary, all these various bodies that are, and commissions that have been set up to address many of these issues. I mean, to have a real and transformative agenda and change, but the tone has to be set up by the leadership, by the president, by the deputy, the leaders of the opposition, whether it's Raila Odinga, whether it is Musalia, whether it's Kalonzo. I mean, Kenyans would like to see them together and talking the same language and putting their personal interests and egos aside and putting the nation in front. I mean, the message has to flow from the top down. We're a very hierarchical society. You could try grassroots. I mean, there's a lot of hopelessness where today churches, civil societies, NGOs, even the diplomatic corps, where they have lost the privileged position they've had before.
The moral authority.
And the moral authority that they had. So it can come back through the politics if the politicians then allowed and give sincere and frank space for this dialogue to take place.